Everyone. Let me welcome all my viewers once again today on Heart Mitra. It's always a pleasure to connect with all of you on these live programs along with our expert speakers. As you are all aware, Heart Mitra is created for all of you so that not only we keep on posted you on the latest happenings in the cardiovascular health field, but also connect you with leading cardiologists across the country who can talk to you as a friend and answer the queries which you have in mind. Today, I am very glad to welcome Dr. Subhasish Roy Chaudhary from Kolkata. Sir, welcome to the program.
Hello.
Sir, today we will be taking in an important topic, and a lot of our viewers they ask about these questions, and that's around obesity and cardiac health, and what's the connection, and is there really a connection around that? So we will be taking questions around that. But to all my viewers, before I start taking your questions, let me formally introduce Dr. Subhasish to all of you. He is one of the renowned cardiologists from the eastern part of our country, and he did his super specialized training in cardiology from prestigious IPGMR and SSKM Hospital, Kolkata in 2013. And now, for last 11 years, he is serving his patients who come to him with a cardiovascular disease. He specializes in complex coronary procedures and also in device implantation. He's a fellow of European Society of Cardiology, and currently he is in charge cath lab and senior interventional cardiologist at Manipal Hospitals, Broadway, Kolkata. Let me, sir, straight away hand it over to you now for your opening comments and set the context.
Hello, everyone. Uh, Today we'll be discussing about obesity and cardiac health, both of which are very important uh, health-related issues nowadays. Over the last few years, definitely the communicable diseases has decreased. It's the age of non-communicable diseases, diabetes, hypertension, heart attacks, and obesity. All of them together forming a conglomerate of diseases which are on the rise. In fact, in India, we have almost one-fifth of the patient of cardiovascular disease associated with obesity. The problem is it's very difficult to treat because it's not only about medicines, it's also about lifestyle modifications. I'm sure there'll be a lot of questions, and I'm sure that we'll have much to tell you about how to diagnose yourself and seek proper advice.
Okay. So, as you thank you for setting the context, and I think as you said that there are close to 20% of the cardiovascular patients who have obesity as well. So, which means that there is a large amount of correlation. So, let me begin with asking you. I think in our country, a lot of people ask that how do we actually define obesity? So, a lot of people relate it to weight, or then we hear about the body mass index or waist circumference. So, for our the common viewers, what they should be looking at and how do we define?
So every time you go to your doctor, you will find your weight and height being recorded. So that's with a purpose because it's from this weight and the height of that person that we can calculate something called a body mass index, a BMI. I'm sure all of you have heard about a BMI. Once we know the BMI of the patient, we can divide it in categories. So anything more than 30 would be obese. Anything between 25 to 30 would be overweight. So we need this categorization so that we are able to pick up the persons whom we would like to treat with the lifestyle modification diseases. There are other measures of obesity, definitely, like the waist hip ratio that is seen. But I think we need to appreciate the fact that we deal with something called a BMI. So when we target, if I'm a patient, if I have a high BMI of let's say more than 3030, this is what should be the target of all my medicines and lifestyle modifications and diet and everything. So the key word to remember is BMI.
Okay, so BMI is something we should be looking out for. From simple height and weight, if you are able to take it from measure it, there are a lot of applications also today on mobile phones. You can simply record that information there and get your BMI. And as Dr. Roy Chaudhary informed us, look at that number, what's your BMI, which is coming. So now you told us that people who have cardiac disease, So 20% of them has obesity as well. But if we look the other way around, so if someone is obese or overweight, then what is the possibility that over a period of time he will pick up the cardiac problems also?
So these are all interrelated, you see. I mean, if you look at the obese patients, almost half of these obese patients will have hypertension. Almost 10% of them will have ischemic heart disease. 5% will have congestive heart failure. So all these diseases, hypertension, ischemic heart disease, heart failure, diabetes, they form a part of something called a cardiorenal syndrome. Cardiorenal metabolic syndrome is where we have a fat person, an obese person with cardiovascular disease. So definitely, if the person is obese, he is more likely to develop cardiovascular disease. So these are all interrelated diseases, lifestyle diseases.
Hmm. Okay, so there is a strong linkage, of course,
Very
and
strong.
the risk factor is, you can say that obesity is one of the high risk factors for picking up the cardiovascular disease. Sir, although we know that these are very complex medical conditions, but for our viewers, in a simple language, can you help us understand that why a obese person would be having a higher risk to catch cardiac problems or an overweight person as compared to a thin individual? What are the basic reasons for that?
The one thing, the physical part of it is very easy to understand, I think. Just imagine a person who is having a BMI of more than 30, who has a weight of, let's say, 100 something weight. So his heart is having to work more. There are arteries going in his along his bodies, which are compressed by the fat tissues. So the heart is going to work more. So the heart is doing more amount of work, gets hypertrophied, it gets thickened. That leads to various heart diseases. That part is very easy to understand. Obesity itself leads to disorders in blood clots and blood, leads to deposition of the cholesterol in the coronary arteries. So this physical part is easy to understand. What's much more difficult to understand is obesity itself is a disease. So now in 2024, we know that due to the presence of fat cells, so that's adipocytes, the fat cells, there is a constant level of inflammation in the body. Inflammation is like, suppose you're having fever, you have an infection. So that's what an inflammation is. So obesity is a constant inflammation in your body, and this constant inflammation leads to activation of various hormones and pathways and receptors, which has very deleterious effects on various organs and definitely on the heart. So one part is the physical association, the other part is the uh, association in the micro level about of interleukins and the various messengers in the bodies.
All right. Thank you so very much for making it a little easy, this complex thing to understand for our viewers. But I think largely we can say that, of course, if the weight is more, so your heart has to work more, and therefore, the heart is at a risk of picking up a disease. And secondly, as you mentioned, there are a lot of other things which will happen inside your body, which you can't see within your vessels, which can also lead to the cardiovascular disease if the weight is high. So now we understand a strong linkage, and you have explained our viewers on this. Now the next question, which comes is that a lot of people also feel that obesity is something which runs in family, or if the parents are obese, so you will also be obese. So is it true that it only runs in families, or it is can be there are a lot of people acquire it otherwise as well due to their habits, and anything you can guide us on?
No, no, definitely. I mean, it has got two parts. Why is one person obese and the other is not? There are some genetic factors and there are some environmental factors. So genetic factors are the ones that I'm speaking of. So suppose my parents are obese, I'll have a tendency to be obese. The other are the environmental factors, which is diet, which is exercise, which are the other diseases that I have. All of this can influence my obesity factor. So it's an interplay between the genetic factors, which I cannot control, which I cannot modify, and the environmental factors, which largely I can modify. So it's important to understand that it's part of that obesity thing we can modify and part we cannot.
And now, in such a situation, what should a person do? So, let's say he picks up that his BMI is above 25, uh, overweight as well. Now, he doesn't have hypertension or diabetes or any visible kind of a disease. But then, what's your message for such individuals? Should they be screening themselves if they are at high risk, or are there any early symptoms, which they should be looking out for, which tells them that maybe this is time for them to consult a doctor for this thing?
That's very important that you need to seek medical help. Once you diagnose or you feel that you're obese, you need to go to a specialist, maybe a medicine doctor, maybe a cardiologist, maybe your endocrinologist, to seek a professional help. So the doctor is going to screen you whether you're obese or not, and then to find out factors which may be contributing to your obesity. There may be some medical factors like thyroid problems. There may be some diet-related factors. It may be associated with other medical conditions like diabetes, hypertension. This may be related to some medicines which that person is possibly taking. But most important, you need to seek professional help. Go to your doctor to find out whether uh, the obesity is associated with other medical conditions which can worsen with time, or maybe simple lifestyle changes, simple diet changes can cut down on the increased weight. So definitely, my advice would be to not start any regimen of exercise or diet without seeking a professional help.
Yeah. In fact, sir, what I was also trying to understand from you is that a lot of people in our system, we don't even treat obesity as a disease, as long as we don't have, let's say, cholesterol, hypertension, diabetes, we don't go to a doctor. So are there any symptoms which are the early indicators of a cardiovascular disease picking up in these patients, which they should look out for? Okay, that if this is happening to me, then I must go to and visit a doctor immediately.
No, the first and foremost thing that the person should realize is the very fact that he or she is obese makes him 2.5 times more likely to develop cardiovascular disease. So once that cardiovascular disease is developed, it becomes more difficult to treat. Rather, it's easier if we can pick it up early. So that's the importance of the obese person going for screening, cardiovascular screening, endocrinologist profile screening, so that we can pick up the disease early. If we are able to diagnose a pre-diabetes, if we are able to diagnose a hypertension in stage one, then definitely the control will be better. You need to understand what's the problem of let's say hypertension. So someone who has been hypertensive, uncontrolled for 10 years will have damage to various target organs, the eyes, the kidneys, the heart. Vis-a-vis someone who has started to develop hypertension and is well controlled with medicines going on for 10 years. Since the hypertension is well controlled, he will have lesser damage to his kidneys and heart and brain and other organs. So that's what we are trying to treat. We cannot cure the patient of obesity, we cannot cure the patient of the metabolic diseases. We are trying to control the factors so that the damage done over time is less. So that's why picking it up is very, very important.
Yeah, thank you for emphasizing. I think this is a very, very important point which Dr. Subhashish is making. Don't wait for some, big symptoms to happen or some disease pattern to be seen already. The very fact that you have an overweight or an obesity situation, that itself is a compelling reason for you to meet a doctor and get yourself screened periodically so that your problems can be picked up early and doctor can help you. That's very, very important because many a times we ignore, we feel that okay, weight is obesity isn't a disease itself. So this is very, very important. So now let's talk about the that how do we take care of this so that the obesity is taken care of and the cardiac related problems they come down. One is that as a doctor, there would be some things which you will be doing, medications and multiple things, and then there are some things which are in control of the patient himself. So let's start with what are the self controllable things, and if you can help us guide our viewers that with respect to nutrition, with respect to activity, exercise levels, and the lifestyle measures, what should be done to mitigate the risk in such patients?
Treatment or the management always starts with what we call lifestyle management. That's number one. which includes dietary restrictions, which includes exercise. So if we are trying to speak of dietary restrictions, it would take a long time to discuss all the uh, proper dietary pros and cons. That will require, again, consultation with the nutritionist. But we need to remember some broad facts, which is trying to reduce weight should be a structured program. It should not be just a compulsive sort of thinking that for a few days I'll not eat and then try to get thin. It doesn't work that way. So if you're trying to reduce weight, it should be with a structured program where we can adopt any of the established dietary regimens, which can be intermittent fasting. I'm sure there will be a lot of how to what diet, what food to have, whether we can fast and all this. So when we speak of food, we speak of foods with less fats, no saturated fats. We speak of lesser amounts of carbohydrates if you're diabetics. We speak of avoidance of junk foods. We ask the patient not to smoke. Most importantly, we ask the patient to have regulated amounts of sleep, which becomes very important. Many of these patients have an associated obstructive sleep apnea, so that needs to be treated. Other dietary part is fasting, where there is a role of intermittent fasting, but that needs to be properly done with understanding of what we are trying to do. Intermittent fasting, if done properly, yes, it has a role. Exercise, again, simple exercises like a 30-minute brisk walk 5 days a week is goes a long way in treating your varied health conditions, your cardiovascular conditions. A more structured enrollment in, let's say, in a gym with a proper instructor can lead to mobilization of your adipocytes, especially along the visceral, along the central tummy fat that we call, which is associated with more cardiovascular diseases. So that's what we need to get out of. But all of this, and I'm speaking of so many things in the same breath almost, all of this uh, has to be monitored, it has to be structured, it has to be part of a program, and this has to precede all the other medications that I can possibly prescribe. So we should be going for lifestyle modifications first and foremost.
Thank you. I think he's emphasized enough on all the lifestyle measures, not only on the diet, nutrition, but also the stress related stress management and the sleep quality as well. So there are misconceptions related to now, how much exercise can be done. It is felt that if someone has an underlying cardiac disease, then by doing more exercise, someone becomes breathless and it can have negative impact on heart. So, what is the reality? Can you help us bust the myths here and tell us the reality here?
And that's what I was trying to tell you, that many of these obese patients, they would go in for exercises and gym training for a week or 2 weeks, and then uh, uh, would get tired and leave it at that. So the important thing is to go to your gym instructor or the person who is there to help out, and tell him about your objectives. So a BMI is calculated, the percentage of fat is calculated, so they're able to give you a long sheet where everything is written. And then whatever exercises we go for, uh, isometric exercises that we go for, at the end of 1 week, 2 weeks, we know whether we have been able to decrease the BMI, we have been able to decrease the fat content. So that's very important. Going into a structured program, this has always has to be related to your diet. I mean, you cannot go to a structured program and be having all your junk foods and all your fried foods at the same time. So that's not done. We need to burn the calories. We need to burn the adipocytes. When does the body use adipocytes? If it has enough glucose, it will never use the adipocytes, fuel from the adipocytes. So we need to, it's one way, that's the concept of intermittent fasting, in fact. So if we do not give adequate amount of carbohydrate to the body, so maybe it will burn up some of those adipocytes, which will help us to lose our visceral fat, which is one of the targets of obesity lifestyle management.
Okay. So, also, sir, help us understand from your experience that are the gym instructors and all, are they equipped enough to guide the patient fully, or before joining a proper structured exercise program, should a cardiologist be consulted before a patient takes it on?
So my role as a cardiologist in this program is to screen the patient for any pre-existing cardiovascular disease. So I need to check out whether the person's ECG is well, whether the pumping function of the heart is well. In certain cases, whether the coronary artery disease is present or not, whether there are blocks in the coronary artery or not, depending on the symptoms of the patient. Once I feel that they are the basic level of ECG, echo, and angiography, CT angiography in many cases nowadays, uh, then I certify the patient to enroll in the gym program. So that amount of safety is required. With that amount of safety, the gym instructor takes over. They are trained enough to suggest which exercises would be good for the heart, would be good in losing weight, and there are nutritionists who will help out in planning your diet so that you take less amount of fat, more of lentils in your
Okay.
whole day food.
Sure. So I think the larger message for our viewers is that lifestyle measures are very important, and within that, exercise, activity level are also very, very important. So exercise is only going to help you if you think that there are some concerns which you have. So take an advice from your doctor, get it, have a consultation before you join for a gym. But it is helpful and it is going to help you if done under supervision. Sir,
And I
will
think just sorry for interrupting. I
yeah.
think we should put in a message here. There's not only about going to the gym. Not everyone has either got the facility or the time or the will to go to a proper gym. But even simple exercises like cycling and swimming go a long, long way in reducing body weight, increasing the strength of the muscles. So many of my patients who have got a strong family history and they ask me for what exercises to do. I do suggest going for swimming and cycling or simple aerobic exercises at home. They go a long way.
Very nice. So I think that's what you hear from our expert today. So take all these options with you and see what makes you most happy and give you a feeling of being fit and adopt that. Are there, sir, other than the lifestyle measures, are there other measures as well, which as a doctor you suggest to your patients, which helps them significantly reduce their obesity situation and manage their cardiac health?
Every obese patient wants a magic pill which will reduce their obesity. Unfortunately, we don't have any. There have been medicines which have been tried over the last some every form of medicine with some amount of success. Currently, we do have medicines which can treat your diabetes along with decreasing your body weight, along with uh, uh, improving your heart failure conditions. So we do have medicines which are given as injectables or as oral. We do have them over the last few years in India also, and some of my patients are doing good on these medicines. But again, I stress the medicines, medicines alone without classifications should not.
Yeah. So there are multiple solutions available to you to help you. So you feel first thing is feel confident about it that you will be all right. But I think everything needs to be done with the medical supervision. And the most important thing, as he mentioned, is the lifestyle measures which you should be adopting. Sir, I'll take in the final question now. Now, those patients who have undergone a cardiac an issue, an incident, or they have undergone the procedure as well. So, what is your advice for them? Because after the procedure for good amount of time, they are a bit inactive. So that increases their weight. So how do you help these patients manage the lifestyles?
So I think the procedure that you are speaking of is, let's say, a patient who has a heart attack, and I have done an angioplasty in these patients. It's very important that I get them back on their feet and to their normal schedule as early as possible. But that should be uh, graded form of exercise as much as their heart can take, because many of these cases, their heart are weak for the first week or so. But at the end of, let's say, 2 weeks to 4 weeks, most of them are back to their normal activities.
All right. So I think as it says that it's the procedure doesn't, let's say, hang you up for a long time. It's for a matter of few days or few weeks, and your doctor will tell you how to, in a graded way, keep up your exercise or activity plan. So I must thank you. I think we have covered the subject largely today, and you have been very kind in helping us answer all these some of the very basic queries as well, which I asked you for the benefit of our viewers. But before I conclude the program, any the final remarks which you would like to make, or in summary, or anything important which we have missed to emphasize in this subject?
I think it's a very good initiative that we are speaking of obesity today as a disease rather than as a shameful condition. Uh, it's not something to be made fun of. It's not something to that. It's a disease. So that's one thing that we have understood now. Just like any other disease, it's a disease. It is associated with all the other lifestyle diseases that we currently have to deal with, like diabetes and hypertension. And so the treatment of it is also integrated into the treatment of diabetes and hypertension separately without treating its other comorbid conditions. But definitely with will of the patient, with treatment of the comorbid conditions, with lifestyle modifications, and with diet, and in some cases surgery, obesity is a very treatable condition. More importantly, if not diagnosed and treated, it can be lethal and deadly. That's a bigger message I think that we should get.
Okay. So I think with these parting thoughts, I must thank you, Dr. Subhashish, for joining us today. I must thank all our viewers as well who joined us live or who would be watching this program later on. So I think some of the important things, first of all, do not ignore if you have a higher weight, you are overweight or obese. And being overweight itself should compel you to meet your doctor and take advice and get yourself yearly screened as well, so that if there is any disease which you are picking up, it is picked up easily earlier and the corrective actions are also taken. And finally, there are enough measures to take care of obesity and mitigate the risk out of it if you are in consultation with your doctors on this. So with this, we thank you. If you have anyone in your friends or family circle looks to be overweight or is having a cardiovascular disease, you can simply share the link of this program with them. And this conversation today with Dr. Subhashish can be very important and helpful for them. If you live anywhere in Calcutta or in Bengal somewhere and you want more advice on this, you can always visit Dr. Subhashish in Broadway, Manipal Hospitals in Kolkata. But if you are anywhere else listening to us, please reach out to your nearest doctor if you have these conditions which Dr. Subhashish highlighted. With this, thank you so very much, sir. Thank you for joining us,
Thank
and
you.
good night, everyone.